So don't say
Sorry
anything,
for the delay.
don't say anything bad about me now because you're being recorded, okay?
All right, I'm done saying anything bad. So
Okay, so the core of the VMSG dashboard is operational planning. So you're going to develop operational plans, you're going to monitor operational plans, and you're going to improve operational plans here. So operational planning is the key. Today we're going to go through in great detail how to develop an operational plan. And remember the pyramid model, we'll go and review that here in the middle here. We're going to talk about every level of the pyramid and go through some real life examples from public health departments of the levels of the pyramid. And then we're going to actually go through and enter a plan in the system at the end here based on the same thing we've been using before, the tobacco cessation model. So you can go see everything that you got to do to actually enter the buttons, clicks, and all that kind of stuff. So let's go ahead and get moving here. First of all, the planning model. Let's go back to there. The organization is just a health department, so it's La Paz Public Health. Underneath that is the structure of the health department. So I can show you what we have in the system now, which was actually put in a while back for the structure. So the top level is the agency, and it's a level 1. So the levels go from 1 to 10. Level 2s always report to level 1s, 3s to 2s, etc. So you see down here we have an accreditation group, and under that we have the old 1.5 accreditation plan. So when somebody gives me the go-ahead, I'll go ahead and replace that with the new 2022 accreditation plan. It's a complete operational plan that kind of automates the whole process of accreditation. Then you can see we have an admin group underneath that. We have emergency response, environmental health, et cetera, down here. So this is the groups. For today, I've added these 2 groups down at the bottom, training, and you can see it's a level 1 group, so it's isolated by itself here. And then under training, we have a tobacco 2024 group, which is we're going to enter the tobacco cessation program in here. In addition to the structure of the department, a lot of times the high-level plans, the ones you see in the bubble, what FAB calls their 6-pack of plans, are individual groups within themselves because they're very, very large plans. Each group that has a set of services or initiatives, a lot of times this is, by the way, the starting point of the plan here. So it's going to kind of define the bucket that you're going to be working in here. Services are ongoing. WIC is an example of a service provided by public health. Initiatives are future programs that we're trying to roll out. So we're going to use the example of tobacco cessation, and it will be an initiative for today. Each service or initiative then is, again, kind of a bucket of plan. You're going to have a set of goals for each one. Goals are a high-level definition. Again, we're going to go into great detail on all this. And then each goal has a set of SMART objectives. Each SMART objective has a set of activities or action steps to get through. So this is the plan model. Now, this nomenclature that you see, organizations, groups, service initiatives, goals, objectives, and activity, is probably the most common nomenclature for an operational plan. However, there's nothing that says it's cast in concrete. And we've gotten plans from health departments all over the nation that have kind of the same model, but the names are different in here. So I'm just going to go through and kind of show you some different examples of plans that we've got, kind of discuss them a little bit as to, what makes sense, what doesn't make sense in these plans. But by doing that, somebody's going to hand you a plan at some point in time, says, put this in the system, and whatever the plan happens to be, it may have different nomenclature. So you're going to be able to go back and say, oh, yeah, I kind of remember that this is equivalent to a service or initiative in the dashboard or whatever. So let's go through some of those. Here's one, strategic priorities. And this is very, very common in strategic plans or your services initiatives. Goals, goals equals goals. Strategies for objectives. I'm not a big fan of that because strategies to me are a way to get to someplace and the objective is the target. So in this case, I would say objectives and strategies are reversed. Strategic areas is a pretty good definition of your services or initiatives. Goals, outcome objectives. I really like that term because the objective is the outcome we're trying to accomplish here. Strategies are the activities. So how are we going to get to the objective? So that one's pretty good. Priorities, goals, objectives, and action steps. Priorities is, again, another pretty good description of the service or initiatives. And action steps is the most common term we see for activities. It's what they are. It's the steps we're going to go through to get to the objective. Priority areas, goals, again, strategies, I don't think is in the right place here, and then action steps. Priorities, goals, objectives, and strategies, that one's real good. And then here's one, strategies at the top. And again, these are real examples of plans that people have sent us. So Sometimes I think that, somebody comes in and says, I'm going to develop your plan for you, and here's my proprietary methodology. So they name it differently, so it's kind of theirs, But strategy, strategic objectives is a pretty good definition of a goal. It's a little higher than the objective, and then objectives and action steps. So again, somebody's going to hand you a plan someday and says, put this in a dashboard. You can kind of look through it and match the name so that it fits, in the nomenclature of the dashboard. So now what we're going to do is we're actually going to walk through the different levels. So the first thing we're going to do, and I kind of showed you your group screen, but a group screen, very typically in the dashboard, again, the structure of the department plus the primary plans typically are the groups. So for instance, the department is your highest level group. It's a level 1 group. Everything reports up to the department. Then you might have under the department, community health division. You see it's a level 2 group. Level 2s always report to level 1. WIC might be under community health as a level 3, or we could promote WIC up to a level 2 group and have it report to the department. And by the way, it's really that easy in the system to move things around. You change the level number and you change the parent group, they call it, and it moves around. It doesn't affect anything in the plans. You don't have to redo anything other than just moving them around for, the way you want them structured in the system here. Now, in addition, as I mentioned, to the departments and offices programs, you might have your high-level plan. So your strategic plan is typically an independent group, with the first level below that being the strategic priorities, or what we call services or initiatives, and then moving down the plan. Your CHIP, your Community Health Improvement Plan, again, another typically a level 2 plan reporting to the department. And today we're going to use the same example we've been using, Tobacco 2024. So it's a bucket, if you will, or it's the container for all of the programs we're going to do around tobacco programs here. So that's your groups tab. Underneath that, you're going to have services or initiatives. And again, services being ongoing, initiatives being future. The only real difference as you're getting down into the system is that when you go to the reporting, it's going to say initiative versus service or vice versa. And typically the activity dates that we'll be talking about are future dates for initiatives. Obviously, we're starting today and moving forward versus something we've been doing for years. So
hey Fred, can I ask a question?
Yes, ma'am.
So did the health department pay for us to have a cardiac health one? Does Melanie have to set all of this up? So you're talking about, tobacco. Are we going to have one set up for cardiac or health, like the cardiac health?
We can set it up any way you want it. So,
okay.
What we had in there was, a little bit dated. So what we're going to be able to do is once you decide, and you can send me maybe an org chart for your divisions, offices, programs, we'll restructure it any way you want to and add any groups that you need.
Okay, I'm sorry, I misunderstood this presentation. I thought we were going under the health for the cardio. We were learning how to navigate that, but it's basically the same thing, right?
Right. Yeah. Every plan is the same structure. So kind of in your mind, think about the plan that you're looking at. You're going to see all the different examples at the different levels, and how to put that plan in the system is basically what we're talking about today.
Okay, thank you.
And Fred, I just had a couple clarifying questions. I'm trying to, and when I was looking at the training and then of course looking at this, I'm trying to bridge the gap in my mind of, I know what you're saying about, PHAB accreditation, and you're putting physical plans in there, EOPs,
right,
pandemic response plans, all those types of things. But I'm trying to bridge, and I'm sure the system does this, but that's what I'm trying to look out for. And maybe this is what you're getting at, Amanda. It's not that we will have a series of plans for this project. It's a grant, right? So it's a project,
right,
and there's a work plan that
right.
we're required to have certain deliverables for ADHS. And the deliverables or activities, which are basically the deliverables, also have a set of outcome and performance measures. So those three words of strategies, activities, outcomes, and performance measures, when you were looking on that other slide where you had different choices of how people called the different levels, when I look at our work plan for the one that we submitted for the grant, that's how it's broken down for this project. So
that's fine.
Anyway, as much as, knowing that a little bit, as we progress through the training, maybe relating it more to that a little bit so that we have that more context from when we start to put these things in there.
Yeah, what,
So
what
anyway.
we do is we'll help you to get started with the plan. So if you have a work plan, and basically everything we're talking about, another name for that, an operational plan is a work plan. So your strategic plan, if you got your strategic plan document, it's got a lot of, and pardon my terminology, a lot of fluff in the beginning, right? So you got all the stuff. How did we do the plan? What are all the steps we went through? When you get down to the bottom line, you got a work plan in there, which is what we're talking about here. So if you guys have a work plan already and you want to send it my way, I'll get it started for you, get it in the system, figure out what the terminology is and that sort of stuff, and then we'll work with you to get it all put in there. But yeah, it'll all put in there. We're just going to show you today the different levels, and then you can kind of in your mind equate to the nomenclature that you have, and then how to actually get it in the system. And then the next training is how to manage it in the system, how to monitor it.
Perfect. Okay. Yeah, that's where, I don't know if that's where you were going to, Amanda, because I'm a plan writer. So, we have a pandemic plan, we have a continuity of operations plan, but that's not it, right? It's just apples and oranges. So I was trying to
well, all of those plans you mentioned can go into the system, and you probably want those plans in the system. And then we got the last planning we'll do is what we call 3-dimensional planning, is to be able to interrelate all those plans. So where do we have commonalities, gaps, and overlaps between those plans? And we'll get into that in the last training. So what we're talking about here are buckets, I call them. And then if you think about it, these are not actions. Nothing that I'm going to show you here is an action. It's just a container for plans that will get us to healthy moms and babies. Readiness for emerging health threats. Effective agency processes. Access to care. Behavioral health and substance abuse. Population health. Organizational excellence. Chronic disease prevention and control, health disparities, and again, we're going to use the example of tobacco cessation today. So these are the buckets of plans. Now, you might just have the one plan, so it might just be, whatever your plan happens to be. Maybe it's your COOP plan as the bucket, and then underneath that, you might have several different goals within the COOP plan and things like that. So, we'll work with you to structure those in there, but we can always make them fit in there. Okay, now under services initiatives, we have what we call goals are a high level goal. Typically, they're very simple, an action verb followed by a few words. So I'll give you some, again, real life examples here. Reduce the risk of infectious disease. Promote safe and sanitary food establishments. Support communities in building resiliency. Enhance healthcare through technology. Drive health in all policy agendas, reduce the risk of vaccine preventable diseases, promote public health readiness and response, promote succession planning and career growth, integrate a data-driven best practices approach, and then again, we're going to use the example of reduce smoking in high schools. So when you look at a high-level goal, like for instance, reduce smoking in high schools, everybody understands what that means. That's pretty self-evident there. What it doesn't tell you is, which high schools. It doesn't tell you by how much, and it doesn't tell you when we're planning on doing it. So the goals are high level. The next level we get down to are what we call SMART objectives, and that's going to get down to kind of the nitty gritty where we define all of that. So if you Google SMART objectives, you're going to get probably 100 different definitions, and I'll just give you ours: specific, measurable, attainable, relevant or realistic, take your choice, and time-based. Now, if it's not attainable or if it's not realistic, why go after it? So I kind of discount the A and the R and look at specific, measurable, and time-based. So here's some examples. By December 2024, our time-based, identify 2 or more strategies, so that's our measurable point, strategies to collaboratively reduce risky alcohol-related behaviors, the specific part. So that is a SMART objective. Here's some other examples. By December 2024, 80% of educators and school staff have been exposed to ACE awareness education. By June of 2024, provide 6 training opportunities for first responders who work with individuals in a mental health crisis. By the end of fourth quarter, all programs will have established goals, objectives, and activities to be reported on within the VMSG dashboard. And then we're going to use the example today, reduce smoking at Wayne High School by 25% by the end of the school year. So I think if you look at each of these, you can very easily pick out the specific, the measurable, and the time-based. So this is our target. This is exactly what we're trying to accomplish. Now, in some places, people have their strategic plan and they'll get down to this level. They've identified the target, but they haven't yet identified how they're going to get there. Sometimes over time, a strategic plan gets completed as it's being executed. So you might take one of these objectives and decide, okay, how am I going to identify those 2 or more strategies? And you're going to start building out the activities in there. So the activities are the steps that will get us to the objective. In the dashboard, there are 3 distinct types of activities. The project-based activity is by far the most common. It was the original and the only one at one point in time. But anything that's actually a project, that'll be completed in a given time frame fits into this category. So here's the example. Create training content and materials for students and faculty on the dangers of smoking. So we're thinking about maybe some PowerPoints and some videos and some user guides and that sort of thing, whatever we need to do the training. Here's where your performance metrics come in. The performance metric is, how do I know when I've successfully completed the activity? So once the training content is built, we've completed the activity. We're going to decide we're going to do it within a given time frame initially. Now these can slip, based on the real world, but we're saying April 1 through May 31st is our time frame here. We're going to do team and team lead assignments. We're going to do external partner assignments. And our measurement in this case is real simple. % complete. How far along are we in creating the training content? The default is 0 to 100%. As I go and enter these activities in the system, you're going to see all the different variations of it here. So that's activity type number 1. And about 85–90% of what you use will be project-based activities. The next type here we call a quality assurance activity. It's the least used type because it's very specific. It's repetitive. So we're saying we're providing 9 training sessions each month. So we're measuring within a monthly cycle. So what's happening is on this activity, that date range is moving forward a month every time you basically enter the data for the end of the month here. So we're going to provide 9 training sessions each month. The other thing that this one does automatically that the other ones don't, for the most part, don't do is set the traffic light. So what we're going to do is put in a value in there that says, if we reach our 9 training sessions, the traffic light will be set to green. And then we're going to pick a red value that says, hey, if we only do 6, we're going to call that not good enough. We're going to call that red. And then the system will calculate 7 or 8 being yellow in between there. So again, it's repetitive, automatically sets the traffic lights. We're going to have, instead of a beginning date and an ending date, we're going to have a cycle start date and a frequency. So the ending date is dynamically calculated by the cycle frequency here in this case, and the frequency can be anywhere between weekly and every 5 years. You select it. So in this case, we're saying May 1st through the end of May, and then we'll move into the next month, June through the end of June, and then July, et cetera, as we're going forward. We're going to have a performance measure. And by the way, the performance measure in the project-based activity is created by you. The performance measure in the next 2 type of activities we're going to talk about is created by the system based on the additional information we have. So in this case, we're saying our performance measure is training sessions provided, measured monthly, in our green, yellow, and red. And then again, we're going to do team and partner assignments. And as you can imagine, our measurement is real simple. How many training sessions did we provide? So that's the QA activity. Then we have the quantitative measurement activity. Very, very similar to the project-based activity, with the one exception that we have a target quantity. So if you think about that, if you're measuring anything that's quantity-based, like contact all 20 tobacco vendors within a mile of Wayne High School, we can go in and say, okay, I did 10. Then the system obviously can calculate 10 out of 20 being 50% done. You can also just measure a quantity at the end of the month. See, how many vaccinations did we do at the end of the month? So the only real difference is having a target quantity in there. We're going to have beginning and ending dates, just like the project-based activity. Our performance measure in this case will be created. So we're going to say, we're completed with this activity once we've contacted 20 tobacco vendors between May 1 and June 30th of 2024. And then again, team and partner assignments. And our measurement, as you can imagine, will be how many tobacco vendors did we contact. So those are the three types of activities and examples of the three activities we'll be using here. So let's take that whole tobacco plan and put it together on a screen. So it's going to look like this. Under the group tobacco programs for 2024, and this again be whatever group you set it to be, you're going to have an initiative of tobacco cessation. Underneath that, you're going to have a goal of reduce smoking in high schools. So one of the objectives for that goal will be to reduce smoking at Wayne High School. Then you can have, as many high schools as you have available here by 25% by the end of the school year. Again, our target. And then the steps we're going to go through to get there. We're going to create training content. We're going to provide training sessions, and we're going to contact those tobacco vendors. Now, this plan can repeat at any level. It can be in a different group. It can be a different service or initiative under this group. It can be a different goal. So let's assume we have a goal of reduce smoking in colleges. So underneath that, we're obviously going to have a SMART objective. In this case, we're going to use Wright State University, reduce smoking at Wright State University by 25% by the end of the school year. And then underneath that, we would have similar activities to get us to that point. So that's the operational planning model. It's really pretty simple. You're just getting more and more detailed as you go down. Now, in the meeting invitation that we sent you, there's this template. You got a blank version of this template. This was actually created by one of our clients up in Wisconsin. What they wanted to be able to do, some of their folks were not real comfortable going directly into the system and entering plans and then updating it, that sort of thing, which, by the way, you can do. It's real simple. But so what they did is built this as a Word document template. And what they wanted to be able to do is go in and build the plan in this template and then basically copy and paste it in the system. So that's kind of what we're going to do today is we're going to take the information in here and we're going to build a plan in the system under that training group here so that you can see exactly how to put it in. And then we're going to talk about all the different details at the different plan levels here. One of the nice things about this template is that it has a quick little definition of what each level is. So for instance, a service or initiative, what bucket of work or priority does this relate to? In this case, tobacco cessation. What is your, I don't know if I like the word pie in the sky, but what's your high level goal here? Reduce smoking in high schools. Then we get down to the SMART objectives. Specifically, what and when do you hope to accomplish? Who's going to lead the charge, your objective lead? The activities are, what are the steps you'll do to accomplish the objective? The performance metrics are tied to the activities. And it says, how will I know when I've successfully completed the activity? And then the activity leads are that team of people who are actually going to perform the activity here. So I have this document as a Word document here. I'll scroll down a little bit here. So what I'm going to do is basically copy and paste. One of the good news is about that is you don't have to watch me type because I don't type all that well here. So I'm going to go ahead and grab our service or initiative, tobacco cessation. Going to copy, Control C. I like keyboard shortcuts. You can right click and copy if you want, but to me, keyboard shortcuts are easier and quicker. I'm going to go back to our dashboard. I'm going to go down under this group, Tobacco 2024. So now what we had was a service or initiative under the tobacco group. So I'm going to go to the service initiative tab. You notice it's blank. I can't enter anything down here at the bottom until I open up a record. So what's happening is anything I enter down at the bottom is on your local computer. And then when I hit this save button over here, it shoves it up to the server. It's just basically a very efficient way to do multi-user computing because you're always working locally. You're not going back and forth and taking up server time and internet time and things like that until you push the button. And then literally it's fractions of a millisecond to get the data up in there. This plus button down here, just like I say, it blocks everything else until you open it up. I can either hit this plus button or this plus button over here. It does exactly the same thing. So I'll click on this one now. Now it's sitting in my service initiative statement. So I'm going to go ahead and say Control V as in Victor is paste. So I'm going to paste tobacco cessation in there. Now, we talked about making this an initiative or a future service, and that's what this checkbox does here. So basically, it's going to affect a few things. Like I say, the reports will say initiative versus service. The activities will have future dates, things along that line. Then I'm going to hit the save button here. So what I've just done is everything I had on my local computer now gets shoved up into the server. You'll notice this button down here at the bottom right, hide service. let's say we've been doing this tobacco cessation program, and let's say the end of June is the end of our fiscal year, and we're done for the year with this program. I want to build a new plan for the next year, but I want to keep this as an archive. That's what this hide service does. If I click on it and save it, you'll notice it grays out up here. The people who can still see it are the manager level users and the org admin level users. The people who cannot see it are the normal users. So the people who are just doing the updates using quick update and that sort of thing can't even see this out there. But if you're a manager, you can look at it. You can go back and do reports on it, anything you want to do. So you've got the historical record or the archive in there. Let's go ahead and unhide that now. Whoops. Helps if I click it. And it's okay. So we got tobacco cessation. Next thing we're going to do is go down to our goal level here. So I'm going to go ahead and select the goals tab. Now, whatever I have selected here, and I go to the next tab down, is going to be, in this case, the goals specifically within tobacco cessation. So it's limiting each time I go down to the level above it. So let's go back over to here. I'm going to grab our goal of reduce smoking in high schools. Again, Control C to copy it. Go back over here. I'm going to hit my goals tab. And again, I've got a block down here. So I'm going to hit the plus button this time. Opens it up. Control V. Reduce smoking in high schools. I can save that. Now, you'll notice at this point in time, we get the traffic light out there. If you're entering an initiative, typically it's a future program, so you haven't had time to get behind schedule. So typically the traffic light is going to be green, meaning everything's moving along as expected. We're going to talk more about the notes and the data source and things in a minute when we get to the objective level. But anytime I change the traffic light or change the goal or something along that line, I might want to put a note over here. Now, this little button right here, and I'll show you that in a minute, is the time and date stamp, time, date, and person stamp. So whatever user actually put the note in there, and then I can type in whatever notes I want. We'll talk about the data source here in a minute. Now, underneath this goal, well, let's talk about the other goals that we have first. So if I'm going to add another goal, if I go down here, we have reduce smoking in colleges. So I'll grab that, Control C, go back over, hit my plus button again, Control V, and just go ahead and save it. Go back over here, grab the third one, reduce smoking in public areas. Control C, go back over here, hit the plus button again, Control V, save it. So we have our three goals. You might have wondered what these little arrows over here on the end are. These are drill downs. So if I'm going to select the specific objectives for reduce smoking in high schools, I can either go up and click on that and then click the objectives tab, which will limit me to the objectives just for reduce smoking in high schools. Or I can save one mouse click by doing this. If I click on this drill down arrow, it selects reduce smoking in high schools and it takes me to the objectives tab. So I'll do that. Just exactly that, saves one mouse click. But if you had a whole bunch of them in there, sometimes it's nicer to be able to look at that and say, this is what I'm looking for. Okay, so here we are down at the bottom again. I'm going to add an objective. So I'll click on that. Go back over to here. Let's scroll back to the top. My first objective, reduce smoking at Wayne High School. So I'm going to grab that. Oops, get it all, that'd be better. Control C, go back over here, grab my objective, Control V. Okay, so I got my reduce smoking at Wayne High School by 25% by the end of the school year. Now, our measurement at this point in time, by default, is percent complete. So we're saying 0 to 100% for the objective to be complete, but that's not what we're measuring. We're measuring percent reduction. So to change that, you just click on the title here. And up here where it says objective percent done, I'm just going to change it to percent reduction. Our measurement units, that's this over here, is still percent. If you're measuring decimal values or something, you could put whatever it is, measuring widgets or car seats or whatever it happens to be. And that would be the decimal selection here. In this case, we're still measuring percent. So I'm going to select percent. And so it changes down here. Our percent reduction is now empty or 0%. We'll go ahead and say we're at 20% reduction. I'll go ahead and save that. So now you notice that status appears up here. The next thing we're going to probably want to do is assign the objective lead in here. The objective lead has two jobs, basically. Number one is to get us to this target reduction. And number two, to update the status of the current objective here. The way he's typically going to do that is through that real-time planning. So he'll get an email notification. The email will take him back in here. They can update this, say, hey, we're at 25% reduction now. Everything is good. So let's go ahead and assign the objective lead. Click the drop down. Now, the reason this is an empty shell here is because there's nobody assigned to the Tobacco 2024 group. So what I want to do is say show all users, which basically shows me everybody in the department. I'm not sure why we have Jamie in there twice. I'll have to look at that. There might be two different email addresses. But since Melanie's not with us today, let's go ahead and assign her. So we're going to.
That's Marion.
Oh, I'm
Oh,
sorry.
that's
We're assigning Marion. Okay.
Yeah, like I wouldn't assign. Yeah, it's not going to really send her an email,
No,
right?
no, I'm not going to do anything right now. This is just for. Great.
She's the health director.
Oh, well, let's change that then.
Yeah.
Let's do Melanie then.
Yes.
Okay.
We'll
So
say
when
we
she
assigned you.
sees the video, she'll think that we're thinking of her. Okay. So we'll go ahead and save that. So now up here, you see that the objective lead is now Melanie. So, so right now I'm looking at the percent complete. We're at 20% reduction versus our 25. I might want to say, we're not on schedule, so I might want to change the traffic light. So I can either just cycle through with my mouse, get to it, or I can use the drop down and select it. So let's go ahead and say it's yellow. And now I'm going to put I got two choices on notes, basically. I can put in, just type in a note. This is a test note, save that. Or I can put a date and timestamp on the note. And what I want to do that is just clicking this little calendar button right here. And you'll see it put the date, the time, and it would put your name in there. In this case, system admin happens to be my username here. So I'm going to go in and say, only at a 20% reduction, set the light to yellow. So that's the kind of note that you might put in there, based on the current status in there, set the light to yellow, everybody be able to look at it that way. The other thing is the data source. So now you're going to have to go someplace to get this information. Where am I going to find, the current reduction at Wayne High School? Could be the Wayne High School website. Maybe they track that. In this case, we're going to say there's a CDC webpage that tracks that stuff. And there's actually one called the CDC Smoking Cessation Fast Facts webpage. So it may or may not be on there, but we're going to go ahead and put that in there for now. So to put the data source in there, I'm going to click here. It's going to open up this window. I'm going to say CDC. CDC Smoking Cessation Fast Facts webpage. Now, there really is such a thing. I think we showed it on the intro here, but I don't know the whole link to it. So I'm just going to put in the CDC webpage in here. Anything you put in the data source link, it can start out on your intranet. So it could be an HTTP or an HTTPS. It could be an FTP. It could be something on your file server, or it could be out on the internet. But it's got to start with, for instance, http:// would get me to the www.cdc.gov. It could be HTTPS. It could be lots of different things in here. Now, if you're going to link to something on your intranet, you'll need to get hold of your IT folks so they can make sure that you have a link through your firewall to get to our servers and things, but we'll work with them on that when you do that. I'm going to go ahead and hit OK. Now, you'll notice down here the data source text shows up here, and this little link button shows up. I'll go ahead and save that again. The link button over here now is going to take me in a new web browser window to that exact data source. So it takes me right to the CDC website. So again, if I had the exact data source, where I'm getting that 25% reduction, current status, it'll take me there. I can grab that value, put it into the objective, and I'm all set to go. So
Fred,
yes.
Fred, sorry, I have a question. Can you put more than one source in that area down there? Is it just the one?
One source per goal, objective, or activity. But you'll find out that once you get down to the activity level that's making up the objective, you can have individual sources for each activity. Okay. So this is the target. This is what we're trying to accomplish. Now we're going to get down to the activity level here. Now the activities have kind of lots of different options, and we'll talk about those. So again, I can't do anything until I open it up. So I'll open that up. Go back over to here and get the right one. Oops. Grab this one. Okay, so my first activity, I labeled a project-based QA and QM. So I'm going to go ahead and grab our project-based activity, create the training content. Control C, go back over here, paste it into here, Control V. Now at this point in time, we're going to select the activity type. And by the way, you can change this as you need to over time, but The project-based activity is the default, so we'll leave it at that. Now, our performance metric for a project-based activity is something you created. It's usually pretty simplistic. So we're going to create training content materials for students and faculty on the dangers of smoking. Now, our performance metric is how do we know when we're done? And you can see we've already got that laid out here. So once the training content material has been created, we're done with the activity. Control C, I'll go over here, paste that in there, Control V. Let's go ahead and say we did that in June. So I'm going to go ahead and say June 1 through June 30th, we're completing this. And we can just say completed early and mark this as 100% done and go ahead and save it. You'll notice this is that QA activity that sets the, oh, I'm sorry. I didn't, no, I'm sorry, project-based activity. I'm sorry, getting ahead of myself here. When I mark a project-based activity is 100% done, it sets the light to gold. We'll go ahead and save that activity now. So what we've got is the basic activity. We've got the activity, the performance metric for the activity, the beginning and ending date. I put a note in there that basically says we're done early. Now, if I were to be, let's say I had 4 chapters of this training I'm building and I completed chapter 1, I'm going to probably mark this as 25% complete. Chapter 2, 50, 75, 100%. So that's kind of the default here. Now, there are some other options. Well, let's go ahead and look at the options. The activity wizard is a little different wizard for each type of activity, but this is going to be the project-based activity wizard. So you've got the beginning and ending date. Now, by the way, it doesn't make any difference whether you put it in here or here. Just kind of simple. It's simple if you're working in here. Data entry type. The default is 0 to 100%. So it gives you a scale to be able to go through and say, when we get to 100%, we're done. You may also just be working and saying, I'm going to do all this in a week. At the end of the week, I want to go in and say I'm done. So you might mark it as complete. And when I do that, the 0 to 100% becomes a checkbox. If it's unchecked, it's 0%. If it's checked, it's 100%. So it's just binary at that point in time. I go ahead and save that. My other option in here, as you notice, was yes, no. In some cases, you're going to have activities that, have we completed this or something, and you want to be able to answer it with a yes, no. So basically the same thing. When it's checked, it's yes, 100%. When it's unchecked, it's no, 0%. Let's go back to the 0 to 100%. Save that. Go ahead and save our activity. So the next thing we're going to do then is we're going to assign teams of people. And that's what we have over here. We've got activity leader and team members. So I'm going to go ahead and click on this little pencil icon here. It starts out by filtering within the current group, and you'll notice there's nobody in this group. The little X clears all the filters. So you can search by first name, last name. You can do an advanced search. So basically, you're searching for any text in there. But right now, if I click the little black X, it clears all the filters here. So we're going to go down here and let's just pick Tina. We're going to make you the lead for this one here. And then we're going to make Karen the team member. So when I click the lead, you notice it set you as a team member and by default gives you the email notification. That is that real-time planning email. So in this case, you would get an email from the system, go back in and update the status of the current status of the completion of the training content. I'm going to go ahead and save this. So now we see down here, we have Tina with the L, meaning lead, the blue around the L, meaning she's got the email notification. And then Karen is a team member. So Karen and Tina are working together to create the training content. Tina is guiding the team. In addition to that, we can assign external partners here. I don't think you guys have any partners established yet. No. So on the left side is partner organizations. Off the main menu, there's a partners app that allows you to build the partners in here. It gives all the information you want on a partner. Each partner then can have a bunch of contacts. So I can say, I have VMSG Dashboard as our partner and Fred Erickson as the contact. You have as many contacts as you want, as many partners as you want. And you can assign as many partners and as many contacts as you want to an activity. And basically what you're saying is these are the people we're working with outside of the health department to build training content at this point in time. So that is our first activity, the project-based activity of creating the training content. Now let's go back.
I have another question, Fred.
Yes, ma'am.
I don't work for the health department. Should I be under partners?
Well, you can be both. If you're going to be logging into the system, you have to have a user ID and everything. So I would go ahead and say, yeah, be a user in there. That way you can edit things. A partner is only a reference to the activity level unless you make them a user in the system as well. So yes, you should be a user.
Okay, thank you.
Yeah, I figured same with me, Amanda, right? I don't work, well, I mean, I work for La Paz County in a contractual sense, but you know, I'm not an employee of the county, but I would think that's probably just a nomenclature thing that we'll have to just overlook or whatever. But
Yeah, sometimes you're going to have external partners, and then sometimes you're going to have external partners who are users.
Yeah, I just wasn't sure if Melanie wanted, you know, myself to go in there and change everything. So,
that'd be a conversation to have with her.
Yeah, that sounds like a good idea.
That's definitely something I'm going to be out there, Amanda, on the 10th. I don't know. We haven't exactly circled back on a lot of this, but maybe that's something we can talk about is, you know, who's going to be populating it. You know, like if I'm just working with Fred to try to get the year one stuff in there, right? Then who would be reporting? So, you know, maybe you'd be just reporting or, you know, anyway, we haven't really worked that out yet. So.
Yeah, well, there's lots of options in there. You can have read-only users who can just get in and look at things. You can have read-only by group, so you can say, you can see all these groups, but you can edit this one plan, things like that. So we can set up any way you want it.
Thank you.
Okay, so let's go back and grab our QA activity here. So I'm going to provide the 9 training sessions each month. Control C, let's go back over here. I'm going to add a new activity. So I cleared everything out, paste it in there, Control V. So we got the provide 9 training sessions. Now, when we do the drop down to the QA activity, it's going to open the wizard for us. So here's our frequency tab. Again, you can see anywhere between weekly and every 5 years. In this case, we're going to say 9 training sessions each month. Our start date is, let's go ahead and say, since we just finished the training content, we'll say July 1 is our start date for the cycle. Now, this is where we decide the green, yellow, and red. So we're going to say if we get to our target of 9 training sessions, it's going to be green. Pick any number you want, but we'll just use the same example of 6 is red. Down, and you notice it calculates the yellow for you in here. We're going to say our performance metric type is going to be training sessions provided. And when I save it, it builds the performance metric. So training sessions provided, measured monthly, green, yellow, and red. You notice the light flipped over to red because our data entry is empty, basically, or 0. If I went ahead and put in, let's say 7 in there, we know that 7 is between the 6 and the 9. You can see the light turn to yellow. So I go ahead and save that. Okay, so now we have that activity in there. We're sitting in yellow status. If I were to go in and update this again, let's say I'm going to put in, now we've done 8 training sessions, and I save it again, you're going to get this dialog. This is the activity. Remember, it's always within, in this case, a monthly cycle. So it's going to say, if you're done with June, do you want to move, or in this case, July? If you're done with July, do you want to move into August? You can say, no, I want to stay, I'm going to continue entering data in this month. Or I can say, pick today's date, whatever today is, the 27th, 26th, whatever it is, 27th. So I could say, pick today's date as my next cycle start date, or I can say select. If I say select, it's going to give me, you'll see the beginning of the next month in there. So I'm going to put 8/1 of 24, and then it would save it to there. We'll go ahead and leave it for now as 7/1 of 24. So what that does is move your time cycle forward as you're ready to. You can say no, or you can just say, yeah, go ahead and move it to the next month or whatever it happens to be. Again, you're going to be able to assign the same as we did before, the team leaders and activity partners in there. And again, in the team can be external partners who are also users in there. Go ahead and save that, say no. Okay, so that's activity number 2. Again, QA, repetitive activity. Number 3 is our QM activity.
And Fred, I'm sorry to interrupt. I do have to go in 1 minute because I have to prepare for my noon one. So if I sign off, then I'll just go away.
Okay, so Tina, one thing that we're going to do after this is I would like each of you to go in and create a quick little operational plan under the training group. So go to the training group, go to services initiatives, put in, it can be something fun. We've had, last one was creating my trip to Italy. That was kind of cool. They did a really nice job, by the way. Doing my vacation, whatever you want to do. And typically it's one service, one goal, one objective, and each of the different types of activities, if you can fit them in there, and just build it in the training group. And then we're going to have a review before we go into the performance monitoring training of just going through the plans, just making sure you understand the nomenclature and that kind of stuff. So
Okay.
I'm assigning you homework as you're taking off.
Okay, is that something you'll email us, or how do we
When,
get access?
Well, you don't have, okay, I'll send you guys the login sheet that tells you how to go in and get your login credentials and everything. So we'll do that.
Yeah.
Let me
Okay.
make
Well, I'm so sorry to sign off, but thank you so much, and we'll be in touch with next steps, Fred, and I'll talk with Mel about what we need to do for next steps from our end as well.
Okay, and also, Tina, you might want to go through and just review the last few minutes of this on the recording when you're done, just to get the QM activity in there.
I will. Thank you so much.
Okay, well, thank you so much, Tina.
Thanks. Bye-bye.
Okay, so the next thing we're going to do again is we're going to add that last activity, the quantitative measurement activity. I think I pasted it. Yeah, contact all 20 tobacco vendors. Going to do the drop down here and say it's a quantitative measurement. We're going to go ahead and say we're going to start that. Let's go ahead and do June 1 through June 30th again. Our target number, as you know, is 20, so we put that in there. Decimal or dollars? Decimal is counting anything. Dollars is obviously that. So you can use this to manage budgets, to manage grants, all kinds of different stuff. So it'll keep track of dollars. It'll let you add to it and everything else. Our metric type in this case is tobacco vendors contacted. And now we got two data entry types. We're going to first talk about enter a value to add to total. So I'm going to click on this. It builds my performance metric of 20 tobacco vendors contacted between 6/1 and 6/30. This down here is my, let's go ahead and save that. So this down here is my data entry. And what I'm doing is how many vendors did I contact? So let's say I went out this week and I did 5 tobacco vendors. What it's doing is adding it to my running total down here now. So it says now I got a running total of 5, and it's calculating 5 divided by 20 to get us 25%. And we'll go ahead and save that. This little thing right here says you changed the value. Did changing the value affect the traffic light? Because in this case, the traffic light is a manual setting in here. In this case, it didn't. We're probably on track to do it. If it did, you might want to go and say, okay, yeah, I'm going to change the traffic light. So that's what that's. And just if you change the value field, does that little dialogue come up? So now we're at 5. Let's say the next week we go in and we do another 5. Add that up. It rolls it up to 10. Says we're 50% done. So that's what that is all about in here. Let's go back to the wizard again. The other thing, we talked about decimal and dollars. That's okay. Enter a new total value. So if I click on that one, you'll notice the roll up goes away over here, and we just have a field to enter. So it took that 10, the current total, and put it up in there. So at this point in time, and this is, I'm doing all this in a week. I'm contacting all 20 tobacco vendors this week. I'm going to go at the end of the week and say I did 20 in there, contacted 20, took us to 100% complete, and we're all set to go with that. So that's what that is about. And there's one other option in there that's kind of nice, and that is what we call a zero target. So let's say you want to count the number of vaccinations that you did this month, but you don't have a particular target as to how many. You just make that a zero target, and all it does is just count up the number that you have actually done. And you're going to go in and say enter it every week or every day if you want to do whatever. So I'm going to say, oh, okay, we did another 5 vaccinations today, rolls it up and calculates to be 25. So those are the different options on a QM activity. Yeah, so either you're going to use the target number to calculate, or you're just going to say, I'm going to count at the end of the month how many, or the end of the whatever period you're looking at, how many we've done in there, and keeps your running total in there. Now, there's one more activity I'm going to add that has nothing to do with this plan, but I want to show you this new type of activity we created called a timeline activity. What it's all about is developed to manage critical documents. I'm sure you could use it for lots of different things in here. Let's go ahead and add a new activity. I'm going to call it update policy 1. So you got a lot of policies in the department. You got a lot of standard operating procedures, a lot of MOUs, grant documents, all that kind of stuff. We had one of our clients come to us and said, look, we've got all of these things out there. We got people assigned to do them, but nobody ever gets notified when it's time to do it. So that's what we did, is we built that right into it. So I'm going to call that a QA activity. I'm going to say we're going to do it annually. So we're going to say fiscal year. So let's go ahead and move this to July 1. I don't know if your fiscal year is July 1, but we'll say it is. And then I'm going to select timeline. And when I do that, everything goes away except the percent to yellow. Percent to yellow is percent of the way through the year or whatever cycle you selected. Could be a 5-year cycle. So let's say I'm going to say 80% of the way through the year. And then I'm going to say update policy. Oops. Update policy 1. Okay. Now, I'm going to save that. I'm going to go ahead and save this particular activity. Again, this has nothing to do with the previous plan. It's just a new kind of a cool toy in here. Now, what you're going to do is take that policy and you're going to attach it as a document. So every screen's got this document management button. You can attach documents anywhere in the system. So I'm going to go ahead and say, let me add a document. I'll choose a file here. And I've got this little test directory. It's got a bunch of little things in it, test. So I'll use the health and wellness document here as my policy. And say upload it. So now you can see the file name down here, the file size, the date, everything. I also have the ability to describe that policy in great detail, and in fact, as much as you want. So I'm going to call this policy 1. Okay. And then I can put notes down here, time and date stamp. I can go ahead and say it's green down here and save that. So now I have policy 1, the document, attached to that particular activity. As you can see here, it's got one document attached there. What's going to happen in this particular activity is we're going to assign somebody as the activity lead in here. Let's see. Let's go ahead and pick Amanda. So you are the activity lead. So here's what's going to happen. About 9.5 months, 80% of the way through the fiscal year, you can calculate whatever that's going to be. This light is going to turn yellow. Remember, we had percent to yellow. That light is going to turn yellow when it gets to 80%. When that light turns yellow and the next email comes out for the real-time planning, you're going to get an email specifically for this activity. It's going to take you right back to this activity, and you're going to look at it and say, oh, I've got to update this by the end of the fiscal year. So what you're going to do is go to the document management, download the current plan or the current policy. You're going to update that policy. You're going to upload the new version of the policy. It'll automatically do version control for you in there. Got the new version in there, you save it, the light turns back to green, you start the new annual cycle again. So what this does is you can set every document that you want to manage that way as a group. Most people create a whole new group called SOPs and one called policies and MOUs or whatever. And then you get down to the activity level, you do it exactly this way. It manages all that for you, so you always know. And by the way, if you get to the end of the year and you haven't updated the document, the light turns red and everybody gets notified that that document needs to be updated. So I just wanted to show you that one. That's, by the way, this has been the most popular feature of the system since it got rolled out about 6 months ago. People love it to be able to track all those documents in there. So that is how to enter an operational plan pretty much all the way through from beginning to end in here. Although one more thing I did want to show you on this particular, let me go back to the QA activity up here. One more thing that you can do. Some cases, less is better, right? I don't know if you golf or not. I don't, but my wife does. So if you want to say that less is better, so maybe 3 is better, I can switch this to less than or equal to. First thing to do is, I think it'll clear these fields, but you got to clear these 2 fields because it's trying to keep the higher and lower in the right place. Clear the fields, click on this guy. It'll make this being less than or equal to, this one being greater than or equal to. So you might have 3 as your green and 6 as your red. So it can flip that around. So you can do it either way. I just want to show you that. Okay, let's go back to the PowerPoint here. Now, the plan that we just created in the dashboard looks just like this. Our group was Tobacco 2024, tobacco cessation, reduce smoking in high schools, reduce smoking in Wayne High School by 25% by the end of the school year, and then the activities we're going to go through to get there. So that is the planning process. That's how you enter a plan in the system. And as I mentioned, I would love for you guys to go out and take the opportunity and just to go back into the group screen. We'll go ahead and save that. Say no. Okay, I'm going to go back to my groups tab. Go down to the training group here, and you have full access to it. You're going to go up here to the service initiative tab, add a new service, and if you wouldn't mind, at the end of the service, just put your initials in parentheses. That way we'll know that who did what. And then you're going to go through and you're going to, whatever you're going to do. I'm planning my Las Vegas vacation. Then my goals are to be able to have my airline booked by July 30th or whatever it happens to be in there. Just build it all the way down. So typically one service or initiative, one goal, one objective. And if you can figure out a way to use the 3 different types of activities, please do that. And then what we're going to do at the beginning of the next session is just review them. It's going to walk down through, and I'm going to give you a hint. Now take this under your wing and don't tell anybody. But where everybody messes up is on the objective. Not everybody. Most people mess up at the objectives. It's not specific enough, it's not measurable, and it's not time-based. So think of those 3 things as you're building your objective, and you'll always win, okay? So that was it. I will go ahead and send you guys the how to log in. There's a document that says, here's how you log in, here's how you change your password, so you can get in there and play with it. If you have any questions or any trouble getting around, please let me know, and I'll make the changes that you need to have done.
Perfect. Thank you so much.
Anything else I can show you?
No, I think that's it. I think I can do it.
Okay.
I guess we'll find out.
I
soon.
also, I'm going to put this recording up on YouTube. We got a VMSG YouTube channel, so I'll put it up in there. I'll send you the link to it, and if you could get it to, and I'll send Melanie the link as well. So if she can go over that, and then we can schedule the next training, which is going to be 2 trainings basically. It's going to be the review of the homework, and it's going to be the performance monitoring training, which is charts, graphs, reports, VMSG Public, all that kind of stuff.
Okay, that sounds great.
So have somebody get back to me and let me know. Next week is kind of out. We've got a lot of stuff going on next week. So maybe the following week would be a good time to do the review and the performance monitoring.
Yeah, we'll definitely have to talk with Mel because she didn't show up for this one. So,
But she will be recording and she'll be able to go through it.
yeah, absolutely. But yeah, we'll definitely have to get with her first and see when they can do it.
Well, thank you so much for your time, Amanda. It's good to meet you.
Thank you. You have a great rest of your day.
Thanks. Bye-bye.